Diabetes testing. In diabetes, the body has trouble keeping blood sugar, glucose, in a healthy range. Unmanaged high glucose may gradually harm your blood vessels, nerves, kidneys, eyes and heart over time. The great news is that most of that risk can be lowered greatly just by monitoring your key numbers and acting promptly. That's the main reason why regular diabetes testing is needed. In this blog article, you'll find out what makes testing important, the tests currently used most in medical practice, when to get tested and the right way to prepare, how to explain your findings in simple words, why iridology can provide additional understanding and motivation. Number 1. Why bother with testing? Consider glucose to be the fuel that keeps your body moving. If you do not supply your car with enough oil, it will stall. If you give it more than it needs, the engine and other parts will become damaged and break down sooner. The numbers from your blood sugar testing show you clearly if you are doing fine or should make changes. Testing can check for diabetes as soon as possible. People can have pre-diabetes or a slightly higher blood sugar for several years without realizing it. If you detect disease early, you might have the chance to stop or reduce the damage. Guide the decisions you make each day. If you know your numbers, you can adjust your meals, physical activity and sleep, as well as handle stress more effectively. Decide on the effectiveness of the treatment you are using. Because you understand your body well, you can modify your medication, supplements or diet with more certainty. Prevent complications. Strong blood sugar control over the years helps keep the eyes, kidneys, nerves and heart healthy. Number 2. The common medical tests. Fasting plasma glucose or FPG. After fasting for 8 hours, your blood sugar should not go higher than 99 mg per deciliter, 5.5 millimoles per liter. Random or casual glucose. The sugar in your blood at any time should be less than 200 mg per deciliter, 11.1 millimoles per liter. Test your blood sugar if you feel symptoms. Oral glucose tolerance test or OGTT. Blood sugar 2 hours after drinking a sugary drink should be lower than 140 mg per deciliter, 7.8 millimoles per liter, and is used to indicate pre-diabetes or gestational diabetes. Hemoglobin A1C or HbA1c. Average blood sugar over 2 to 3 months should be no more than 5.7% for ongoing management. Finger stick or home meter. You can test your blood sugar on your own, receive your glucose levels right away and make daily choices with your personalized goals. Continuous glucose monitor or CGM. Glucose values are checked every few minutes through a small sensor. It gets your glucose trends in real time, which is particularly useful for athletes and technology enthusiasts. Please like and share this video, leave a comment below, subscribe to this channel and scan our QR code to have a chat with us. Laboratories and different health plans may have small variations in targets. Stick to what your healthcare provider recommends. Number 3. How often should you test? When you are healthy and have no risk factors, a fasting glucose or HbA1c test every 3 years along with your normal physicals. When you are pre-diabetic, let your doctor run lab tests twice a year. Checking your blood regularly at home can encourage changes in your daily choices. People with type 2 diabetes, you may need lab work 2 to 4 times a year and they should follow your care team's instructions for checking your blood sugar levels daily. For those using insulin or expecting a child, you may be advised to test frequently, up to 6 to 10 times a day or have it monitored continuously. Number 4. Preparing for your test. Fasting tests require you to drink water for 8 hours only. Take your medication unless otherwise advised. Stay hydrated. If the body becomes dehydrated, glucose may increase. Steer clear of anything that increases stress or heavy exercise just before the test, since your readings might be affected. Tell the lab about supplements or over-the-counter remedies. Some, like high-dose vitamin C or biotin, can skew certain assays. Number 5. Reading the numbers in everyday language. When your glucose is normal, between 70 and 99 mg per deciliter fasting, it means your insulin is functioning well. If your blood sugar and A1C are in the pre-diabetes range, between 100 and 125 mg per deciliter fasting, 5.7 and 6.4% A1C, it's time to lower your sugar and refined carbs, get more exercise and add targeted supplements. Whenever your fasting blood sugar measures 126 mg per deciliter or more and your A1C is 6.5% or higher, that means you have diabetes and it's time to start healthy changes with the help of healthcare professionals. Low blood sugar or hypoglycemia, around 70 mg per deciliter or less, may result in shakiness, dizziness or confusion. Administrate 15 grams of quick sugar right away, for example, 1/2 cup fruit juice, and recheck after 15 minutes. Number 6. Iridology, an eye-opening addition. By studying the color and markings in the iris, practitioners use iridology to discover a person's health strengths and weaknesses. A magnifying lens or camera is used by practitioners to trace tiny fibers, rings, pigments and openings and then match them to the organs and body systems. How can iridology help with diabetes? First warning signs. Signs of a weak pancreas zone. Brown patches or a white glucose ring may indicate blood sugar changes and alert you to the problem much earlier than lab tests. This discovery at an early stage encourages you to make needed lifestyle adjustments. Whole person view. Instead of looking only at blood sugar, iridology outlines connective tissues, liver function, adrenal strength and how digestion is working. Because diabetes is affected by stress hormones, gut health and liver detoxification, understanding all of these factors helps plan a comprehensive program. Clues regarding personalized nutrition. For example, a thicker iris may suggest the body is having trouble clearing toxins, so it's helpful to drink extra water and rest your body. When digestive problems are present and lead to gut lining inflammation, eat foods rich in probiotics to improve your glucose levels. Being motivated and accountable. Having your iris chart, often using color codes, gives you a vivid and lasting look at your inner wellness. A lot of clients say that having this visual reminder helps them make better food choices. Non-invasive, without pain, and it's done in a short time. You won't see needles or have blood drawn and your results are instant. It means children, adults who dislike needles and all those interested in more detail between appointments can use it. Important. Iridology is complementary, not a substitute. On its own, it is not designed to diagnose diabetes. You should use its advice along with proper medical testing and support from a health expert. A sample scenario. In Maria's case, 42 years old, she had a typical fasting glucose, 95 mg per deciliter, but iridology showed a pale pancreas area and a marked stress ring. The iridologist said that her pancreas was working hard to lower her glucose levels and that her adrenal glands were under extra strain. Motivated, Maria switched to cinnamon-spiced herbal tea instead of having sweetened lattes. Started taking a 20-minute walk in the morning. Took 2 5-minute breathing breaks at work. A leafy green magnesium-rich smoothie was the choice for dinner. 3 months after that, her HbA1c went down from 5.6% to 5.3%. She experienced greater calmness and lightness and continued with testing and iridology consultations to check her progress. Integrating both worlds. Baseline. Conventional testing. Annual glucose plus HbA1c. Iridology support. Initial iris map to flag tendencies. Action plan. Conventional testing. Diet, exercise, medication. Iridology support. Iris clues to guide diet, such as foods to support the liver and herbs for stress relief, monitoring. Conventional testing. Home meter or CGM. Iridology support. Follow-up iridology consultations every 6 to 12 months to check for changes. Motivation. Conventional testing. Numeric targets. Iridology support. Changes in the iris and individualized explanations. Long-term care. Conventional testing. Eye, kidney, nerve screenings. Iridology support. Continual iris reviews as health concerns may be developing. Take-home tips. It's important to know your fasting number and A1C. If you don't remember your last test date, make sure to set up a test this week. Log your readings. Spotting patterns is easy even with just writing them down in a notebook. Consider seeing an iridologist if you want an easy, healthy view of your body or some help staying on track. Pair knowledge with action. Keeping your blood sugar steady depends on balanced meals, enjoyable physical activity, good sleeping habits and less stress. Create a team of people who can help you. A nutritionist and a skilled iridologist can bring different and helpful knowledge to your approach. Getting your blood sugar tested will inform you and guide you toward improved health. Lab tests accurately measure certain parameters, whereas iridology shows a bigger picture of your body's overall health. Both science and wisdom from the eyes work together to provide accurate preventive guidance. Embrace both science and intuition, continue to learn and always remember, you lead your health decisions.